This
specializing
conference will
in
now be recorded.
endocrinology. What I try to do through this session is I've tried to just make this a open platform and a safe space where people who are going to give their exams in the coming weeks. So we've got lots of exams coming up in the next few weeks, and we've had lots of students asking lots of questions as to how to approach things on the actual exam day, on whether they've got some doubts which are in their mind. So we've been getting lots and lots of emails. So just to make sure that everything gets covered and everyone feels comfortable with their exam, we've set this session up. This is a completely safe space, guys. So if you have any doubts or any questions which you might think that might sound silly, or you might feel embarrassed to ask them, please do still ask them, because we want to make sure that when you go to your exam, you perform at your best level. Okay. So guys, people on Facebook, YouTube, as well as GoToMeeting, guys, if you have any questions, start typing onto your chat windows so that I can start answering them. If you're on Facebook, then please comment onto the comment box as to what questions you have, and then I'll try and cover as much as I can today in terms of any questions that you might have for your OET exam. Okay. So starting off is Manish has asked, can we underline the case notes while reading for first 5 minutes? So Manish, if you're talking about the writing subsection, in the initial 5 minutes, it's a strict reading time. So at that point, you're not allowed to touch your stationery. So what you can do, and what lots of people do like doing, is that they go through the case notes and read them twice during that period of time. So remember, we've got two things onto case notes, if you might remember, which is content and clarity. So you're supposed to include all of the information which is important to your audience, and you're supposed to exclude all of the information which is not important to your audience. So in the first 5 minutes, what I would suggest is, one, you understand who your audience is. Is this a GP? Is this someone who already knows the patient, so you don't have to include a lot of past medical history for this patient? So is that somebody who's quite familiar with your patient? Or is this somebody that is completely going to get this new patient that you've transferred into their care? So in that case, they would need to know each and everything which is pertinent to their particular specialty. So in the first 5 minutes, organize your thoughts, identify your audience, identify what you want to include and what you don't want to include. Take it, if you're a very fast reader, read it 3 times, so that once your 5 minutes are over, you then start first your purpose, you underline your purpose, and then you just underline the important points that you want to include. So the first 5 minutes are actually very good, but if you use them properly. Another question: how often should we use the patient's name in a paragraph? So what we usually advise people to do is, first of all, you write the patient's complete name in the subject line. So Mrs. Rosetta Stone, and then you write the date of birth. And then when you start the actual paragraph, you can start out by saying, thank you for seeing my patient, Miss Rosetta Stone, comma, a 35-year-old lady. And then you just go on by saying Miss Stone or Mrs. Stone, whatever salutation they want. Just mention it 2 times. I would avoid using terms like the patient on your actual OET letter. So using terms like Miss Stone or Miss Stone has been suffering from all of these symptoms or something. whatever you want to write, you can do that. All right. Guys, keep asking questions onto the chat window. And then we'll try and answer everything. All right. So we're getting a few questions. Okay, so people who've just joined us on Facebook, hello, my name is Dr. Bhavna Sharma. I work as an endocrine registrar in the NHS London, and I'm a part of the Teachio Academy. And today on this session, we're just going to do a live session on the last minute questions that people might have for their OET, because we've got the exam coming up for lots of people. They're coming up in the next few weeks. So we want to answer as many questions as we can today. All right. So Julieta has asked, sometimes I struggle with abbreviations if there is one that I don't know what it stands for, but I know it is important to mention it. For example, a medication the patient was given. Should I just type the abbreviation just as it is, or it's better to avoid? Okay, so Julieta, that's actually quite a good question. Remember, the main thing about your OET writing, or what they want to assess, is that when you come and work in a foreign country and you're asked to write letters or put in medical communication, they want to see how safe a doctor or a nurse you would be. Okay, so if you've got a patient who's on certain medications, which are quite important medications to them, and they're going to another doctor or another healthcare practitioner, the safest thing would be that you mention that medication's name. If you don't know the full form, the correct way to write that is by writing everything in capitals. Okay, so for example, if there is someone who is on methotrexate, so a common short form that we use in day-to-day life for methotrexate is MTX. So what you would have to do is you would have to write MTX in all caps. So that's the way you correctly write medications or short forms in English, by putting it in all caps. I would not avoid it, but I would definitely include all of the pertinent information and not avoid abbreviations. Julieta, if you want, what you can do is if you email us on teachioacademy@gmail.com, we can send you a list of the common short forms which appear on your OET. So everyone who undergoes our writing check and struggles with abbreviation, that's the list that we send them. So if you want to get that list, so just email us and we'll send it across to you. Ashwarya has asked, do we address a child by first name in the letter? So Ashwarya, it's up to you. If a child is a teenager, then you can write Mr. John, Mr. Smith, or something like that. But if it's a very small child, some people like writing baby Juliet or baby Smith. It doesn't really matter. Or you can sometimes also write master or miss. They will definitely give you a salutation which they want to get used in the form of when they write the actual name of the child, they will give the salutation along with it. So just use that. Diksha has asked, when we refer a patient from one GP to a new GP, what should be included and what should not be included. Okay, so Diksha, if it's one GP getting a patient as a new one from another GP, then obviously this is going to be a new patient for that GP. So this is going to be a transfer letter. So if it's a transfer letter, you have to include all of the medications or all of the past medical history for the patient, because the new GP is going to start from a blank slate. So then they need to know whether your patient's got hypertension, how long have they had the hypertension for, is it a well-controlled hypertension, is it a poorly controlled hypertension, what medications are they on for their hypertension, are they allergic to any particular antihypertensive medications. They need to know all of that. So you're going to definitely include all of the information. Aruna has asked, are we allowed to underline keywords in reading passages? So Aruna, you can actually do that, but some people do like underlining the important points. So if you go back to Mr. Manoj's session on reading, he covered reading part A, part B, part C, and he gave unique strategies for each part of reading. Which you can watch, and he's actually told you about what parts you want to underline and what parts you don't need to underline. So if you just go back to our YouTube channel and go through those sessions, that might help you quite a lot. Guys, if you can hear me, please type in yes, because some people are saying that they can't really hear anything. So please type in yes if you're able to hear me, and then we can start answering further questions. Okay. All right. Okay. Another question. In speaking, if we are talking to a relative of our adult patient, do we need to ask for their consent? If yes, how would you do that? So Julieta, that's also quite a good question. Guys, if you're not familiar with this, generally in most Western countries that you're going to give your OET for, you need to take an adult's consent before you share any of their medical details with another person, because it's an English exam. It's not a strictly medical exam. What I would suggest is that for your actual OET, you just use this line. You say that, for example, I've got this person, Mr. Smith, and he is not that well, unfortunately. And the scenario is that I've got to speak to the daughter, whose name is Sarah Smith. Okay. So what I would say is, hi, Miss Sarah Smith. My name is Dr. Bhavna Sharma. I am a ward doctor working in this hospital. I'm looking after your father, Mr. Smith. Before we start this discussion, I presume that Mr. Smith has given his consent to share medical information. Is that correct? And the interlocutor just might say yes. Rather than wasting a lot of time, just use this standard line, and that's going to make your life quite easy. So you can say that, or you can just lie. What you can say is, I can see from my notes that Mr. Smith has given us a directive that we can share all of his medical information with you. Okay, so if that makes you uncomfortable, then just use either of these two lines. Shama has asked, can we write more words in listening section, or it's strict in the number of words? So they'll usually say that you can either write a short phrase, or you can write just one letter. So I would not really write more than a short phrase on your actual listening section. But guys, one thing that I just quickly wanted to mention, because lots of people do ask that, is that when you're doing your listening and reading, please make sure that you read the sentence completely before you submit your answers, because the answer has to make sense grammatically. Okay, sometimes they do this thing about singular and plural, where what you're listening to is in singular. So they might say that lots of patients have been, or what we can do is, they might say that psoriasis is a common disease, and it's found in 1 out of 10 patients. And then they might say that many dash have symptoms of psoriasis. So even though you heard 1 out of 10, or 1 out of 10 person in the population suffers from psoriasis, if it says many, then you have to write patients rather than patient. It's very pedantic, but that's something that they are looking for on your OET listening and reading. Also, if there's a, an, or the, mostly with a and an, just make sure that your word which you fill in the blank is matching that. So if it's a, it should be a consonant. If it's an, it should be a, e, I, o, u. Alicia has asked, can we completely skip the past medical, social, family, personal history when we send the patient back to their previous GP? So Alicia, it has to be a decision based on what the presenting complaint of your patient was. Okay. For example, if they came in with uncontrolled hypertension or uncontrolled diabetes and you change something, then you would definitely have to mention that. You might write, even though Mr. Smith has had well-controlled hypertension since the past few years, on this episode, he was found to have a blood pressure of 200 over 150 millimeters of mercury, and we replaced his ramipril with amlodipine. Okay, so you have to just make a medical decision as to what additional things have you done for the patient. That's your first priority that you're going to tell to your GP. And the second thing is just making sure that anything which might help the GP make his decisions, that should be included as well. Rather than skipping everything, just make a conscious decision. Okay. Evangelista has asked, what's the difference between a referral letter and a transfer letter? So this was, if you go, Evangelista, if you've got a little bit of time, if you go to our YouTube channel, this was covered by me in a previous session where we talked about the 3 different types of letter on your OET writing. Just let me just draw out that session because that might help us. Okay. So on this letter, on this session, what I tried to cover was the types of letters that you might have on your OET writing. So guys, there are actually three different types of letters, three broad categories of letters, which might come on your OET writing. So the first one is your usual referral letter. So referral letter basically means that you've got a patient, but you're not able to optimize their medical management by yourself. So you refer your patient to a medical specialist or someone like a social worker or a psychologist who's going to look after your patient in that particular specialty. For example, if it's a social worker, they're going to manage your patient's social needs. If it's a psychiatrist, they're going to manage your patient's mental health needs. If it's a surgeon, they're going to probably perform a surgery for your patient. This patient will still remain your patient. They're just going to that specialist because you need a little bit of help in one aspect of care for the patient. So that's your referral letter. Transfer letter is that you're sending this patient over to another medical practitioner, and the patient is no longer going to remain your patient, and the primary caretaker of your patient will now be the new person. Okay, so it's like you're playing ball with one of your friends. Okay, if your friend borrows the ball for a little period of time just because you want to fix something on it and then he returns it back to you, then that's a referral letter. If the ball is given by you to your friend and now it becomes your friend's property, then that's going to be your transfer letter because the ball got transferred from you to the new owner or the new caretaker for it. So the patient now becomes the other person's patient. It no longer remains your patient. If you've got a transfer letter, that's why it's quite important to include all important points in a patient's history or the patient's background. While if it's a referral letter, you would need specialty specific information. So if it's a surgeon, they want to know about the surgical background of the patient. If it's a psychiatrist, they want to know the mental health background of the patient. If it's a social worker, they want to know about the social background of the patient. That's the only thing they're concerned about because they don't want to know everything about your patient. They only want to know what's going to affect their management. Okay. Diksha has asked, what happens if we can't finish the writing task? Does it mean that the grade is straight C? Diksha, you definitely want to finish your writing task. If you're struggling with your writing task timing, what I would suggest is spend a little bit more time highlighting the important points because the OET writing letter shouldn't actually take more than 20 to 30 minutes. So if you're not able to finish it, it might be that you're writing a bit too much or you're going above your word limit. There's nothing like there's nothing which says that if somebody doesn't finish their writing, they'll get a C. It just depends upon how well you've written it. If you've just missed out writing yours sincerely or doctor, but rest of your letter is perfect, you still should be able to pass. But Diksha, if you're struggling with your timing, do look at what you're including on your letter because as I said, OET letter writing should not take more than 20 to 30 minutes because it's just 180 to 200 words. It's not that large of a task, so it should finish on time. Okay, guys, if you have any questions, please start typing into the chat window. Okay, we're just trying to go live again on Facebook. Okay. Hi, everyone who's just joined us on Facebook. This is a live session on OET last minute preparation. So if you have any questions related to OET, then just please type into the chat window or type into the comment box. All right. Okay. So Manish has asked, if the transfer letter is from GP to GP, or it can be from a GP to a psychiatrist also. So Manish, usually transfer letters are what the classical transfer letter which appears on your OET is when a patient is admitted to your hospital and you send them to another hospital, um, but you were taking care of the patient for a short period of time, but then you refer them to another hospital and now the patient is going to become the other hospital's patient. That's the classical transfer letter which appears on your OET. But yes, you can have GP to GP transfer letters as well. GP to a psychiatrist transfer letter wouldn't really be possible because the psychiatrist is not going to take ownership of the patient. They can only manage the mental health of a patient, okay? But the GP will still remain the main doctor for your patient, so it'll be a referral letter. In three, if the medication list would be in terms of dosages would be important when the medications are getting changed or the new medications that the patient is getting started on, okay? Because then if you started the patient on some new medications in a certain dosages for a certain period of time, and this patient is now getting discharged to their GP, the GP will have to follow all of this up, okay? So in that case, it's quite essential that you include the medication dosages. But yes, if it's a GP who already knows the patient and you haven't really made any changes through the dosages, then you don't need to mention the medication list. Shama has asked, in writing, is it allowed to exceed the writing limit? So Shama, the writing, this word count is suggestive. But if you are exceeding your word limit by quite a lot, it's highly likely that you're including things which are not pertinent to your audience, and then you're going to lose marks on your clarity. So try, if you see that you're consistently going above the writing word limit, then there are definitely problems in your content, but I would definitely advise not going above 240 words or so, because that's going to create a lot of problems. Patrick has asked, can we write the name of the medications in capital? Patrick, we have discussed it in our previous session, but just for everyone, this is quite important and a lot of people do struggle with this. If you're talking about generic medications, so things like metformin, insulin, if it's not a named insulin, so insulin, the generic name, paracetamol, the generic name, aspirin, amoxicillin, any antibiotic in its generic name, they're all going to start with small letters. But brand names for medications like Eliquis or Corderon, or any named insulin like Humulin M3, they will all appear in capital letters. So make sure that we do that. Aruna, yes, we're going to upload this video on YouTube, but if you have any questions, please do ask them in the chat window so that I can at least cover them. Ashwarya has asked, in writing, can we make a rough draft? Ashwarya, what I would advise is, rather than making a rough draft and wasting your time on doing that, on your actual notes, you can actually highlight that 1, I'm going to cover this in the first paragraph, 2, I'm going to cover this in the second paragraph, 3, this is going to be a part of my conclusion, because that's just going to save you precious time on your OET writing, rather than writing a rough draft and then copying it on to another page, because then you're going to definitely run out of time. Okay, so Alicia has asked, I need your help in these kind of circumstances. The patient has been operated for varicose veins, and now I'm sending her back to her GP. She has a history of diabetes and hysterectomy. She's a non-smoker, has significant family history of hypertension, diabetes, and rectal cancer. In this kind of a situation, can we just skip all of this information? Because I think this history doesn't have any impact on the present situation. Alicia, that's fine. If you did nothing to the diabetes, you didn't do a repeat hysterectomy on your patient, you did nothing about their hypertension or them having a family history of hypertension, then it's definitely not important to the GP and you can definitely skip it. Yasir, GP to GP letter, if a patient was one person's, the first GP writing the letter, they were the ones who were responsible for the patient first. And now the patient is moving to another area and the GP is writing a letter to a new GP who's going to be the patient's main caretaker now. That's going to be a transfer letter. Okay. Yeah, so if you still don't understand the concept of differentiating between referral, transfer, and discharge letters, please go to our YouTube channel and you should be able to get a view as to what are the different types of letters, because this is actually quite important for your exam, because the information that you include, it varies with the type of letter that you have. Okay. Guys, please keep typing into the chat windows for any questions that you have. Indri has asked, is it okay to leave more than one blank line between paragraphs so that you can add additional information in those paragraphs later when needed? Indri, that should be fine. Gabi has asked, my test is on coming Saturday. Is it possible that he can get his letter checked by Teachio? Gabi, if you just text Dr. Prashant on the number provided, we are prioritizing letter checks for people who've got their exam coming up quite soon, and we're getting them checked in about 24 hours now, but you'll definitely have to mention that when you book your checking. Patrick has asked, do we need to introduce ourselves in emergency condition in speaking? Patrick, even when you're working in the resus, when you come and work in the UK, you need to know who your patient is. You don't want to be doing things when a patient has certain advanced directives, or let's just try and give an example, okay? If you've got someone who's had a major hemorrhage, and you don't ask their name, and you just straight away go on to taking them to CT, giving them some blood transfusion, giving them whatever treatment you want to give. But you didn't ask the patient's name. And then later on, you've done everything. You go on to the patient's notes and you find that they're a Jehovah's Witness. So now you're going to get in a lot of trouble. This is just a very extreme example, but this is just to illustrate that, one, the OET is not real medical life, and two, even if it was real medical life, you need to know the patient's name, and the patient needs to know your name. Okay, that's basic medical practice. Okay. Dalat has asked, how can we write disease, example, diabetes or diabetes? So he's just trying to ask whether it would be small or capital letters. So Dalat, all the common diseases like diabetes, any type of cancer, any pneumonia, they're all in small letters. But diseases which are named after a person or a place or a scientist, they're going to be in capital letters. So Pompeii's disease, for example, the P is going to be capital. Guys, if you have any questions, please type into the chat window. Diksha, I'm still waiting for your question. I can't really see it on the screen still. For people who are on Facebook, guys, if you have any questions, please type into the comment box, because that's how I'll be able to see it right now and answer your questions. Okay. Patrick, definitely, if you make mistakes, spelling mistakes on your OET writing, you're going to lose marks. Guys, please make sure that you don't spell the patient's name wrong, because lots of students are doing that. And it's just embarrassing when you're writing a letter and you're spelling your patient's name wrong. That just shows that you're very casual about writing the letter. So make sure you don't spell the patient's name wrong. If you've got any findings which were on the case notes and you're copying them from the case notes onto your letter, please make sure you leave 5 minutes at the end just to cross-check whether the spellings are right, because this is just basic copying. You don't want to mess that up and lose marks on the OET because of silly mistakes. Diksha has asked, can we add word or words in a sentence by indicating an arrowhead? Because sometimes we forget certain words and then erasing and writing again, the sentence will become time consuming. Diksha, that's fine. That's what we do in our common life. We do put in arrowheads, but make sure that it's quite clear and the examiner can definitely see where you wanted to insert the words. So make sure that you do that, but no problems. Ashwarya, you'll have to use a 2B pencil. So it's not the common HB pencil that we use from day-to-day life. So if you want to go and get that for yourself before your exam, that's going to be quite helpful. Do we need to ask the details of a parent of a child in speaking? So you're definitely going to be speaking to someone, and when you're speaking to someone, it's good to know their name. What I would advise, if you're talking to a child or you're talking to the parents of a child, what you would like to do is you would ask, hi, my name is Dr. Bhavna Sharma. I work as a doctor in this hospital. I can see from my notes that you are baby John's father. Before we start, can I just ask how I can address you? So you always want to ask who the person in front of you is called, because when you're talking to them, it's a good communication skill that you know their name. For example, you might insert words like, okay, Patrick, we've discussed John's immunization till now. Before we move on, is there anything else you would like to ask me? So that's quite useful to know the name of the person sitting in front of you. And obviously in OET, you've got marks for relationship building, which is initiating the interaction appropriately. So asking the name is going to take about 2 seconds and you're going to score well on the relationship building part. Okay, guys, please type into the chat window, or if you're on Facebook, it would be useful if you can comment onto the chat box. For people who've just joined us, hi, my name is Dr. Bhavna Sharma. I work as endocrine registrar in NHS London, and I'm a part of Teachio Academy. This session is to do a live question and answer session for people who are going to be giving their OET exam quite soon, but they've got some last minute doubts that they want solved. So if you have any doubts, whether you are on YouTube, on GoToMeeting, or on Facebook, please type into the chat window, or on Facebook and YouTube, you would have to comment onto the comment box to ask any questions you've got with regards to OET. Gabi has asked, do we need to finish the speaking task in 5 minutes strictly? So actually, it depends upon what your interlocutor is doing. Usually the time is in between 5 to 8 minutes. You can definitely not go above 5 minutes, not go above 8 minutes. But if you finish by 5 minutes and you've covered everything and the interlocutor still isn't stopping you, what I would advise everyone to do is summarize your task, summarize all of the details that they want, details that you've covered during the discussion. And that's just eating up time. Till the interlocutor stops you, don't stop. Okay. So Dalat is asked regarding paragraph organization after reason, referral, or transfer letter in the first paragraph. Then the second paragraph, we have to tell the patient's current situation or tell about relevant medical, family, or other history. Otherwise, we can write medical history in the latter. This was the layout I saw in the official OET webinar. So Dalat, it depends upon you how you want to organize your letter. If it's an emergency situation, then you might want to cover what happened on this visit, what was done on this visit, and then go on to past history. There is no definite template that you want to cover this here and that here and that. It just depends on common sense as to what you feel like. So just imagine if this was real life and you were writing a real letter, or you're doing a medical handover. You always want to present the case in a way which is the most efficient. If you've got an emergency situation, you would tell them, this patient came to me with a major hemorrhage. I arranged 4 units of blood transfusion for him, and I arranged a CT angiogram, and we found a bleeding vessel in his common iliac artery, and the vascular surgeons have fixed it. His hemoglobin is now stable and his vitals are doing well. And then you write, Mr. John does have a strong family history of polycystic kidney disease, and he himself has well-controlled hypertension. since the past 20 years. You don't want to begin that scenario by saying, so this is Mr. Smith. He's got hypertension. His mother and father had a history of polycystic kidney disease. You don't want to begin it like that. You want to begin with the most important thing and then go on to the supporting information. It's just like common basic medical handover. You want to prioritize what's important. And I know the people are getting confused by the official template which was described, but this again was discussed by the official OET people again, and they did emphasize that there is no specific template for each and every kind of letter. It just depends upon what the scenario is. Okay, so Ashwarya has asked, how do we introduce in a case where you are their family GP and have done multiple family visits and we need to summarize? So Ashwarya, the first and the last visits are important because the last visit was the one which prompted you to make the referral, and the first visit gives you the best background for the patient. In between, you would include those visits which had certain positive history or certain changes that's going to affect their management plan. For example, I've got a patient and I am this patient's regular GP, and I now want to refer this patient to a social worker. I've been doing multiple family visits for my patient. The first time I saw them was when they were referred to me for home visits because there were concerns about neglect at home. So I'm going to mention that I was first referred this patient in 2009 when there were concerns regarding neglect and possible safeguarding issues. And then I've done that. I've mentioned the first visit. After that, I did a number of visits. In March 2009, I saw them and the patient was completely normal. In February 2009, we had someone go into the patient's house, but it was locked, so they couldn't access it. In January 2010, we went into their house, but we found that the patient had an episode of drug overdose. Okay, and then again, I saw them in December 2012 when they had a childbirth in their family, and they were quite happy about it, and they were going to a party. Okay, now Ashwarya, think about which of these visits is going to be important when someone is taking care of this patient. The visit which would be important would be the first one. The other visit which I would definitely include was when they had the episode of a drug overdose. So in between, I'm going to include only the visits which contributed to this patient's management. So the social worker would definitely need to know about the drug overdose. So that's just using basic common things or common sense when you're writing your letter. It's just like a medical handover. Okay. All right. Kalp has asked, in transfer letter, do we need to add all info or select relevant data? So Kalp, you need to include all of the positive history in a transfer letter because now the other person is going to become the patient's primary carer. So you need to include all of the positive information. Diksha has asked how to start with the patient's relative who has come in on behalf of the patient, but patient's name is not given in the role play card. Can we just start the name by an imaginary name or start like, I understand from your notes that you are the son, daughter, wife, or so and so. Can I get your name, please? You can ask them. So what some people like to do is during their prep time, when they're actually sitting with the interlocutor and they're just going through their case notes and the interlocutor is just sitting in front of them, you can ask the interlocutor what the patient's name is, and they might tell you that. But otherwise, if you've missed that, what you can do is you can say things like, hi, my name is Dr. Diksha. I'm one of the ward doctors working in this hospital. Before we start, can I please confirm the patient's name? And then they'll do that. And then you ask them, I can understand from my notes that you are the daughter of Mr. Smith. How can I address you? So things like that. That's good introduction. Yes, please. If you have an inpatient and you're asked to explain a procedure, what you might do is you might say things like, just as a, you might say things like, just as a routine check, I just need to confirm your name and date of birth with my case notes, and then they'll tell you their name and date of birth. Please introduce yourself to the patient and ask the patient's name. This happens to us each time when we do ward rounds in the morning. We always have to introduce ourselves to the patient and tell them what your name is, because then they might forget, and it's just basic polite medicine. Okay. So Ashwar has asked, in a speaking scenario, how do we introduce in a case when you are their family GP and have done multiple family visits? So what you would do, again, you would say that just as a routine medical procedure, I need to introduce myself again to you. Hi, my name is Dr. Ashwarya. I have been your regular GP for a few months. Can I please just confirm your name and date of birth so that I can match it to my case notes before we start? So something like that. Then there's another question about whether taking OET at home might be better. Guys, it just depends upon your choice. If you go to our YouTube channel, you should be able to see a complete analysis, which I've tried to compare OET at home with a regular OET. Some people, they love OET home, they think it's the best thing ever, but some people, they're not very good with their typing, or they're not very good with reading from a screen, and they're the ones who struggle with OET at home. So it just depends upon what your personal preferences are. Okay, guys, we're going to reach the end of our time quite soon. So if you have any questions, please type into the chat window. Otherwise, we're at the very end of our session for today. And people on Facebook, if you want to type into the chat window about any questions that you might have with regards to OET and OET writing, please type into the chat window. Patrick has asked, what will happen if we finish the task before 5 minutes? What I would advise, Patrick, in that case is that you practice summarizing. So you summarize the visit. I would advise you to use as much time as possible. Okay. You want to show the OET that you've got good English and good clinical communication, and you have to take as much time as possible to prove it. Unless the interlocutor stops you, don't stop. And if you've got time at the end, a very, very good technique is to summarize the discussion. So you're going to say things like, all right, just to summarize today's discussion, Ms. Smith, we discussed about your new diagnosis of multiple sclerosis. I explained what multiple sclerosis is, that it's an autoimmune disease which tends to attack the nerves in the brain and spinal cord. I explained that the symptoms are quite variable, as to some people might have very, very minor symptoms, while some people might suffer from a severe form of the disease. I explained what the treatment options are, and I discussed what the side effects of various treatments might be. I also spoke to you about getting in touch with the occupational team and the physiotherapy team, because it would be quite useful if you have a good exercise regime and we ensure that you've got the best quality of life that you can, even with the disease diagnosis. So things like that. Just summarizing the whole discussion is quite useful, because what I found is most students, they do much better in terms of their grammar in summarizing part, because it's something that you're reading out of your notes and you've already discussed all of that, so you're comfortable with the topics, and it's quite a good method of explaining or showing the OET that you've got good English. So either what I would advise is that try and go through the official OET exams and see what your level is. If you're struggling in one particular section on the OET, for example, you're struggling with writing or speaking, then you can opt for checks, writing and speaking checks with Teachio Academy, and we can help you out with it. For reading, what I would do is read as much medical literature as possible, because that's just going to increase your speed. So for treatment, Manish, can you just elaborate why you want to find out whether it's a countable or uncountable noun, so that then I can explain why the sentence would be like that? Piece, what I would say, that if you want to refer to a cannula, you call it an intravenous cannula, and a catheter, you would refer to that as a urinary catheter. You use the full thing. So Manish, if you're talking about treatment, then you would refer to treatment as the treatment that we've provided you today includes whatever treatment you've given them. The treatment options are that we offer you medication versus do a conservative management. So those are the two ways that you can use treatment. So personal history, so personal background, if there's someone who's got a lot of social issues and they're struggling with neglect and you want to refer them to a social worker, or you've got someone who's not managing well at home and they're not able to manage their daily activities, then mentioning the fact that they live alone or they've got no family support does become important. So it just depends upon what your scenario is like. I would mention the patient's age, because even in common medicine, you need to know whether it's a 20-year-old who's had a heart attack or a 79-year-old, because it affects the treatment options, it affects the diagnosis, it affects the rehab. So it's basic medicine to know a patient's age. Manish has asked, the treatment has undergone many treatments, but still his pain is intractable. So Manish, you can write that in two ways. You can either write the patient has undergone many rounds of treatment. Okay, so that's going to be a single, or you can say that the patient has undergone many types of treatment, but many treatments also should be fine. All right. So we might start wrapping up the session for today. Guys, we're going to give it about 2-3 minutes in case anyone has any last minute questions. Otherwise, we'll wrap up today's session. Okay. All right. So that was the session for today. Guys, if you have any questions at all and you're a part of our WhatsApp groups, I'll be keeping a close eye on our WhatsApp group for, till the next Saturday, because we've got lots of people who've got lots of anxiety with their exams coming up. So we want to avoid all of that. So make sure you are on one of our WhatsApp groups or the Telegram groups so that we can answer all of your questions before your OET test, because I want everyone to pass their OET this time, now that it's finally happening with the pandemic and everything. For everyone who's got their exam either on the 19th or the 26th, all the very best. Guys, please take some rest before your actual exam. So the last day, tomorrow, if your exam is on Saturday, Friday, just take some rest. Please don't go through these multiple rounds of material that everybody's been circulating around. It just confuses your mind, okay? So try and relax, get a good night's sleep. If you take caffeine, avoid that in the last day. Take it on the morning so that the caffeine has its best effect. And make sure you don't skip breakfast, because the OET is a very long exam. It takes a long time. You've got to wait for your speaking. So you don't want to get have a rumbling tummy on your exam day. Don't listen to people who are asking multiple doubts outside the exam hall, because they just confuse you and make you very, very nervous. Treat it like an English exam. Yes, it is an exam which is going to affect your career and probably catapult your career to greater heights once you pass it and you want to come and work in a foreign country. But treat it like an English exam. So have a sense of humor about it. If you're not, if you think that you've messed it up, then it's fine. There's always a next time. There's no maximum number of attempts. You can give this exam 1,000 times. No one will stop you. If you've missed one part of the exam, do the next part nicely so that at least you get good practice. And you never know, even the part that you think you haven't performed as well, you might just make it through. So I hope everyone does extremely well in their upcoming exams. I hope you have lots of fun giving the OET, and you treat it like an adventure and hopefully come out on top. So good luck, everyone, and just stay safe, and the very, very all the best from our Teachio team, all the best from me, Dr. Prashant, as well as Manoj sir. We send all of you guys all best wishes, and hopefully we'll see you on the other side. Good luck.